What's up, YouTube? Welcome back to my channel, or if you're listening on the podcast, welcome to the Nursing Connect podcast. And in today's video or episode, we are going to be talking about how to become a virtual nurse or how to get into virtual travel nursing if that is where you're trying to go with your nursing career. And if you are new here, I'll just give a very brief introduction of myself. My name is Ava. I'm a registered nurse. I've been a nurse at the time this video is being made 5 years. I did 1 year at the bedside. I was a float pool nurse as soon as I graduated nursing school. That was my first nursing job. That was back in 2021. Then in 2022, I became a virtual nurse, and I have been doing virtual nursing of all types ever since. I have done acute care virtual nursing. I have done hospital at home virtual nursing. I have done telephone triage virtual nursing, and I have done remote patient monitoring. So I feel like I've got a good spread or variety of virtual nursing experience to share with you all how I get these jobs and how you all can get these jobs too. Before we move any deeper into the video, I would love to introduce you all to today's sponsor. If you have any interest into getting into virtual nursing and becoming a virtual nurse, you're gonna want to learn about today's sponsor. Let's get it. Nursing Connect is a virtual nurse staffing company. We place nurses in virtual nursing roles, whether they are on-site or fully remote. We place RNs, LPNs, and nurse practitioners. If you are interested in learning more about the agency, you can click on the link in the description. You can submit a resume or a few jobs. Not only does Nursing Connect place virtual nurses, we also offer training and education for virtual nurses. And our newest course is called the Virtual Travel Nurse Course. It is a complete course, and we show you step by step on how to become a virtual travel nurse. All right, in the course, you have access to every role that you can be deployed into as a virtual travel nurse. We show you a day in the life and train you on the role. Once you've mastered the competency, you will get a CE credit or a certificate of completion that you can put on your resume to demonstrate that you have competency in this area of virtual nursing. We also give you some tools to help you build out your resume to help you land the virtual travel nurse contracts. And then we go through and tell you exactly where these contracts are, how to find them, and where you can start your virtual travel nurse journey. If you are interested in becoming a virtual travel nurse, this course is for you. But before you even invest a dime into taking this course, we have developed a free virtual travel nurse starter guide that is linked in the description below. If you are interested at all in becoming a virtual travel nurse, this is an excellent place to start. Check out the link in the description, and let's head back over to the video. Before we move deeper into the video, I wanted to break down what is virtual nursing, right? It is 2026, and the definition of virtual nursing has drastically changed since COVID 2020, right? Virtual nursing, when we used to think about it, we thought about like, oh, you can work from home doing like health insurance and case management, and those types of virtual nursing still exist. But in this video, I'm really going to be focused on the virtual nursing that happens within a hospital system, because that's how you get the virtual travel nurse contract, and that's how you start to be able to work from home as a nurse and still have your hand in the door in the hospital, right? So yeah, COVID-19 drastically changed what it means to be a virtual nurse. And I'm gonna break down the different types of virtual nursing just so you have a baseline knowledge of what kind of jobs you're applying for and what your day in life is going to look like. So the first form of virtual nursing I want us to get into is acute care virtual nursing or inpatient virtual nursing. Some of you all watching this video might already know what this is, but I'm gonna break it down for the people who don't. So an acute care virtual nurse or inpatient virtual nurse is a virtual nurse that delivers virtual nursing care directly at the bedside. They are basically an extension of the bedside nurse. Another way that I like to describe it is virtual bedside nursing. So your main role is to support the bedside nurse on the floor, and your other goal is to support the patient who is receiving the care, right? And when I was doing virtual nursing, they scaled it across multiple hospital systems. The main unit that we saw this type of virtual nursing being practiced was medical surgical, because that's the unit that has, unfortunately, a very high turnover rate. Nurses come and go. Hospitals are looking for sustainable ways to try to keep nurses in nursing and virtual nursing. I'm not saying it's the solution, but it's a dang
dang good stab at it, right? So basically, you as the virtual nurse, you are there doing the admissions. So you'll call the patients over the TV or over a tablet, and you will deliver your virtual nursing care that way. Now, traditionally, the way that I have done virtual nursing, I have seen it done, is the patients have cameras on top of their TVs in their hospital rooms. And that's how you access your patients, right? So you call them and you support them by doing things like admissions. So all those questions you ask when a patient is first moved into the hospital, you know how the bedside nurse had to do that. They still have to do some of that documentation, but not all of it, not nowhere near the way that it was now that we have the virtual nurse to kind of offset that burden, right? So you'll do the admission, you'll do the discharge, you'll just do all the teaching with the patient upon discharge, make sure they understand their after visit summary or their discharge instructions before they leave the hospital. Traditionally, that was left to the bedside nurse, and sometimes it is depending on if the patient is appropriate for virtual nursing, but now that is shifted off to the virtual nurse. You're also there to round on the patients. You can round on the patients Q3, Q4, once a day, depending on what the needs are and the type of unit. You can call in and check on those patients pretty frequently. And all I can say about that is rounding saves lives. So having another nurse just look in on your patient while you've been somewhere else for another 30 minutes, that is super helpful. You also do medication sign-offs and skin checks. So you're really, really there to help support that bedside nurse and the patient. And these hospitals are expanding to that, right? With that being said, they're expanding this innovation and they need nurses to staff it. So what do? They start to look for contractors, i.e. travel nurses, right? And I'm gonna circle back into how you can get to that type of virtual nursing doing travel, but I'm going to shift into the next type of virtual nursing. All right, so the next type of virtual nursing that you can get into that hospital systems are also shifting towards is something called hospital at home. I would have never guessed it. I only figured out about hospital at home because I took a virtual travel nurse assignment and I commuted to the hospital, and on that virtual nursing unit, I was one of the virtual nurses that was delivering care to the patients remotely in their homes, which was pretty cool. So I'm just going to give a brief definition of what this model of care is and how nursing is tied into that. So hospital at home is a model of care where patients, they can finish their hospitalization at home, right? These patients are still hospitalized, but not to the point where they still need to take up a bed on the main floor. Now they can finish their hospitalization at home and have access to two nurses. They have access to a virtual nurse 24/7, 365, and then they also have access to a nurse that comes into the home and does all the physical cares for the patient. So like wound care, infusions, they do the physical assessment while the virtual nurse is available 24/7 on the back end to do any other things like medication pass, assessments, discharges, admissions. They're always available. And that was kind of my role when I was doing virtual nursing for the hospital home program. And y'all probably trying to figure out, what do you do all day for 12-hour shifts doing virtual nursing for hospital at home? Well, the hospital at home division or department, it functions just like a unit on the floor, because it is now. So when you come to work as a virtual nurse, you have a set of patients that you care for. Now the ratio when I would go to work, it was either 3 to 5 patients I would have on my caseload that I would be caring for throughout the day. You were also responsible for any transfers that came to the unit. So if we got a patient that was stable enough to come off the floor and transfer to hospital at home, say from like a med surg unit, then you would be the nurse to take a report on that patient and get everything coordinated and set up for them to have a safe transfer home to continue their care. Now this one threw me in the job interview when I was talking to the nurse manager. She said virtual nurses can administer medications. I said, huh? She was like, yeah, y'all can do a virtual med pass. You just have to do the 6 rights of medication administration. I was like, oh, okay. And I didn't really fully understand it in my interview until I started doing it, right? So the medications that you can deliver as a virtual nurse over the tablet safely are things like blood pressure medications, pain medicine. You can do like creams or powders. The patient has to be able to care for themselves to be a part of this program. So they have to independently show you the medication label, the front and the back, and you verify you've got the right patient, right dose, right route, right time, right drug. And so you do all that, and then in Epic, instead of marking it as given like you would on the floor, you mark it as hospital at home observed, right? You just mark that you observed the patient take it over the tablet. And the in-home nurse, they'll come back and they'll go see the patient, and if they need an infusion or an injection, they'll be the ones to do that type of medication administration. But if a patient wants Tylenol, all they have to do is call the virtual nurse and be like, hey, am I okay to take this at this time? And all the medications that are sent to their home have been reviewed by the pharmacist, and they have been ordered by the doctor. So they're not just taking whatever's in their house and we're verifying. No, these medications were delivered and they're part of their care. And the only reason why I know so much about hospital at home is because that's where I took my first virtual travel nurse assignment. And I did not realize that virtual nurses were needed on these types of units. And now I'm sharing with you all, yes, they definitely are needed on these types of units. And with all of that said, I'm gonna move into our next type of virtual nursing, which I think this type of virtual nurse has been around for some time, but I think more hospitals are adopting this too. So the next form of virtual nursing is remote patient monitoring / telephone triage. So when I was on my virtual travel nurse assignment, not only was I caring for patients on hospital at home, some shifts I would also care for patients by doing remote patient monitoring, and I would be the nurse available for the Ask Your Nurse line for patients to do, just to call in if they had any questions about, you know, their care or had a nursing concern, then they would just reach out on that line. So as far as what remote patient monitoring is, basically what we would do is we would send the patients, after they got discharged from the hospital, we would refer them to a program that was also set up within that same hospital called remote patient monitoring. And basically the patient would get a scale, blood pressure cuff, pulse ox, and a glucometer if they had diabetes. And we would send them home with that. And then on the back end, the nurses, we would monitor. So every day they would put in their vital signs. And if anything came back out of whack, if their blood pressure was too high, too low, oxygen level too low, you know, anything without or not within normal range, we would reach out to them, do a quick assessment, see if they need to be escalated back to the hospital, or we can just reach out to their PCP and kind of let them know what's going on. It was a way to keep patients out of the hospital longer. And this program significantly decreased the readmission rates for patients that had liver transplants, kidney transplants, and then a lot of the other patients we had is like heart failure patients. Those were the main service lines we would service with the remote patient monitoring program. Right before my contract was about to end, they were about to start servicing hemonc patients on certain chemo drugs that we will monitor remotely as virtual nurses to kind of decrease the hospitalization rates for those patients too. So I believe more hospitals are going to start looking into building that into their service after patients are discharged, just simply because it had such a big impact on the readmission rate for patients coming back to the hospital. All right, now that I have fully defined the different types of virtual nursing that are relevant to this video, I'm going to share with you all how you can shift into virtual nursing roles such as these. And you all, this is going to be solely based on my experience and how I got into virtual nursing, and that is the best I can give to you. And I hope that this information is super helpful and at least plants the seed and lays a foundation on, you know, what's possible in nursing. So circling back to the acute care virtual nursing, that was my first virtual nursing position. So I was a support nurse for the bedside nurse. And the way that I got that position, I used to work for a digital health company called Medical Solutions. They definitely hire virtual nurses. I was able to get that role with only 1 year of bedside nursing experience, and I worked there for 3 years. I absolutely enjoyed it. I loved it. The pay, it was very competitive, the bedside nursing. I'm a nurse in the South, so the pay was about anywhere between $30 to $32 an hour. So that range was very comparable to what I was making at the bedside. So I decided to just jump ship and go into virtual nursing with Medical Solutions. If you take this information and decide to go apply on their site and everything, I'm just gonna give you a forewarning. You will not be doing virtual nursing at one hospital. You will be doing virtual nursing at many hospitals across the country, okay? And they will have you in groups, and you will be doing rounding, education, you'll be doing skin checks, sign-offs, all of that for multiple hospital systems across the country. Yes, it is a fully remote position, and the scheduling is 3/12s. So you work day and night shift, 12-hour shifts as a virtual nurse. All right, now that I've shown you, or we talked about how to get into virtual nursing remotely, working at home, I'm gonna also introduce you all to virtual travel nursing. That is the best way I can describe what this is, because circling back to the definition, hospital systems are building out these virtual nursing programs, all right? But in order to do that, they need nurses. And in order to get nurses, sometimes they go to these agencies and they contract nurses out to come either staff their virtual nursing unit, or sometimes the nurses are able to work remotely as a virtual nurse and still get paid like a travel nurse. yes, this really exists. All right, now I'm going to share with you all how I got into virtual travel nursing, which agency you need to go to, and which specialty you need to filter things out to be able to find these positions. So I ended up getting my first virtual travel nurse assignment from Aya. AYA is the agency. And when I went to look up the virtual nursing position on their website, the specialty is labeled telephonic triage call center. That is virtual nursing. I don't know why it doesn't just say virtual nursing, but yeah, I just kind of filtered through there. I found where it said telephone triage call center, and when I clicked that, I saw all of these travel contracts for virtual nursing. Now, my first virtual travel nurse assignment, I did have to commute to the hospital. So I lived in North Carolina, and the hospital I was working at was in Virginia, and I did have to commute to the call center near the hospital to deliver virtual nursing care and to collect stipends and all that. So I did that for about 9 months. The second virtual travel nursing contract I picked up, surprisingly, I did not have to commute. I was able to work fully remote in North Carolina, and the hospital is located in California, but they needed travel nurses to help with staffing. So I was able to get that contract from Aya by using those filters and finding assignments like that. Now, when you go and look at the assignments on Aya, it doesn't say whether it's remote or on site. Sometimes you won't know until you talk to the recruiter, because my second virtual travel nurse contract, I didn't know it was remote until after I talked to my recruiter. It didn't say anywhere in the job description. And the pay for virtual nursing or doing virtual travel nursing, when I was doing it, I made about $2,000 a week when I had to commute to the hospital to deliver virtual nursing care. But when I started working from home, I was making about $60 an hour doing virtual nursing with the overtime rate of $90 an hour. If you have made it this far in the video, can y'all just give me some love? Because I'm really putting y'all on game for free. $0 and 0 cents. Can y'all just comment if you still here? Like, just give me some love. Or if you're listening to this on the podcast, can you drop some nice reviews about the episode, because I'm giving y'all some true gems. No other nurse on the internet is talking about this right now, and I'm really trying to put y'all on and set y'all up for the future of nursing. And you just enjoy me in general, you can follow me on TikTok. That'll be linked in the description. You can follow me on YouTube here. You can follow me on Instagram. I'll link that in the description. Yeah, and you can find me on LinkedIn. My name is Ava Bethea. We can connect on there. I'll also have that linked in the description. And let's talk about what you just heard in this video. How do you feel about the options and the opportunities that are now being presented for nurses? Did you know about it? Did I teach you something new? Let me know. All right, I'll see y'all in the next video. Bye.